you. Well, good morning to all of you. Thank you for taking time to be with us, and a special thank you to my colleagues who we share the stage with today. I'm Congresswoman Jen Kiggans, and I proudly represent Virginia's 2nd Congressional District. What you see before you are a bipartisan group of congressmen and women who have come together to find a solution to a problem that all Americans care about, healthcare. We did what we said we would do after the 43-day government shutdown. We came together to discuss healthcare reform and the looming expiration of ACA enhanced premium tax credits. The group on this stage is sincere in our desire to ensure Americans have affordable healthcare coverage. As a geriatric nurse practitioner, co-chair of the Nursing Caucus, and one of the 2 nurse practitioners in Congress, it's an issue that I personally and professionally care about, and is why I'm here with my colleagues to impress upon our Republican and Democrat House and Senate leadership that we can find bipartisan solutions to provide affordable health care for the people who need it the most. Although we may have different opinions over the long-term solutions for reforming marketplace health care, or if there are even better and cheaper options for publicly available health insurance, we agree on the many aspects of the short-term solutions and are here today to share those with all of you. Although many bills have appeared to offer similar ideas, we wanted to propose more of a bipartisan framework to make it clear to the House and Senate leadership that defined ideas do exist, but that both sides of the aisle support. And you'll see on our letter that we have 15 Republicans and 20 Democrats, and I'm sure we could find more when we try harder. We stand here today facing an end-of-the-year expiration of the enhanced premium tax credits already in place, and recognize that the clock is ticking and the deadline is looming, and that implementing effective solutions will take time. The ACA is what is before us. I have 40,000 people in my district who rely on this health care, and doing nothing to prevent a spike in their premiums is wrong, especially after all the positive work we've tried to do with Working Families Tax Plan to address everyday affordability issues. With this deadline in front of us, we have broken the bipartisan framework we present today into 2 necessary steps and conveniently a 2-year process. And you have your page in front of you, so I'll spare all the details, but just know in summary, year 1 or step 1 is extension of the ACA enhanced premium tax credits, including things like income caps, some guardrails for waste, fraud, and abuse issues, PBM reform. Year 2 or step 2 would be continued reforms as agreed upon in the House and Senate by this summer, which would be before the midterm election season, including some options like physician fee schedule increases, hospital billing transparency, elimination of $0 premiums with provisions for need-based hardship support, implementation of HSA accounts based on the Cassidy bill, which would eventually eliminate the need, hopefully, for premium tax credits, and including the Give Kids a Chance Act to accelerate pediatric cancer treatments and expand access to life-saving therapies for children battling rare diseases. In closing, I offer the Oxford Language Dictionary of Compromise, an agreement or settlement of a dispute that is reached by each side making concessions. It's a word that we don't use often in the halls of Congress, but it's something the American people are craving and anxiously waiting for us to demonstrate that we understand and aren't afraid to use as a tool to get things done for them, the people we represent and serve. Lastly, thank you to my colleagues who have agreed to work on an issue near and dear to my heart, and I look forward to continuing to work together to ensure all Americans have the health care they deserve and can afford. Thank you very much, and with that, I'd like Susie Lee to come speak.
All right, thank you.